Many people with high blood pressure believe that taking their medication daily is enough. But there's something few people pay attention to. Blood pressure isn't affected only by salt or aging. It's also strongly influenced by long-term nervous system stress. When you worry too much, overthink, sleep poorly, or constantly stay in defense mode, your body activates the sympathetic nervous system. This makes your heart beat faster, your blood vessels tighten, and the pressure inside them rise. What's important is that this state can quietly continue for years. You may eat normally and take your medication as prescribed, yet just a small amount of stress can cause your blood pressure to spike again. Some people measure normal levels in the morning, but see them increase by late afternoon or evening. It's not necessarily because the medication isn't working, it's because the body hasn't truly relaxed. Understanding this root cause is the first step toward supporting more stable and sustainable blood pressure control in a natural way. The Japanese not only focus on healthy eating, but also pay close attention to regulating the nervous system. Instead of emphasizing intense workouts, they prioritize exercises that help the body slow down, activating the parasympathetic nervous system, which is responsible for rest and recovery. When this system is activated, the heart rate begins to slow, blood vessels relax, and the body shifts into a state of deep calm. This creates the foundation for blood pressure to lower naturally. What makes this approach special is that it doesn't require endurance, heavy effort, or sweating. It's especially suitable for middle-aged older adults. Rather than trying to fight high blood pressure, this method helps the body self-regulate from within. The gentle, consistent practice, combined with mindful breathing, is what creates more sustainable results over time. What surprises many people is how simple this exercise really is. There's no need to lie on the floor, no equipment required, and no need to change into workout clothes. All you need is a sturdy chair and a few quiet minutes each day. The main focus is sitting in the correct posture and consciously slowing down your breathing. Even people over 60, those who are less active, or those currently taking blood pressure medication, can safely do it. The key isn't intensity, it's consistency and proper rhythm. After just a few minutes, you may notice your heart rate slowing down and your body feeling lighter and more relaxed. If you'd like me to guide you step by step so you can practice it at home right away, leave a dot in the comments below. For this exercise to be effective, your sitting posture is very important. Sit on a sturdy chair with both feet flat on the floor and your knees bent at about a 90-degree angle. Keep your back naturally straight, not overly arched but not slouched either. Relax your shoulders, avoid bending your neck forward, and gently tuck your chin in slightly to keep your spine aligned. You can rest your hands lightly on your thighs or place them on top of each other in front of your abdomen. The most important thing is that your entire body stays relaxed, no tension. If you notice your shoulders lifting or your jaw tightening, consciously release that tension. Many people think posture doesn't matter, but in reality, when your back is curved or your neck is bent forward, your lungs can't fully expand. This prevents deep breathing and reduces the effectiveness of the exercise. When you sit correctly, you'll feel your breath moving down into your abdomen more naturally. With just these small adjustments, your body is ready to enter a deeper state of relaxation. The most important part of this method lies in the breathing rhythm. You don't need to force a very deep inhale or tense your abdomen. Simply breathe in slowly through your nose for about 4 seconds, feeling the air move down into your abdomen. Gently pause for 1 to 2 seconds, then exhale even more slowly for about 6 to 8 seconds, either through your mouth or nose. The key is this: your exhale should be longer than your inhale. When you extend the exhalation, your body receives a signal of safety, and the parasympathetic nervous system becomes more active. Your heart rate begins to slow, blood vessels gradually relax, and feelings of tension noticeably decrease. While breathing, keep your shoulders and neck relaxed. Don't lift your shoulders as you inhale, and don't hold your breath for too long. If you feel slightly lightheaded, return to your natural breathing for a few seconds before continuing. Just 5 minutes a day, done gently and consistently, can help your body gradually adapt and respond more positively over time. What makes this method effective isn't how long you practice, but how consistently you do it each day. Just 5 minutes in the morning after waking up or in the evening before bed is enough. There's no need to extend the time excessively or push yourself too hard. The body, especially the nervous system, responds best to repeated rhythm. When you maintain a daily habit of slow breathing, your heart and blood vessels gradually adapt to a more relaxed state. Over time, your body begins to remember that sense of calm and can return to it more easily during moments of stress. Most importantly, keep it gentle and stay consistent. It doesn't have to be perfect, it just has to be regular. Small, steady practice each day is what creates lasting change for blood pressure and overall heart health. Even though this is a gentle exercise, it's still important to do it correctly to stay safe. First, choose a quiet, well-ventilated space and sit on a sturdy chair. Avoid practicing right after a heavy meal or when you're extremely tired. If you feel dizzy, nauseous, experience chest pain, or notice your heart racing while breathing, stop immediately and return to your natural breathing rhythm. If you are taking blood pressure medication or have heart disease, continue your medication as prescribed by your doctor. This exercise is meant to support your health, not replace medical treatment. It's also important not to force very deep breaths or hold your breath for too long, as this may cause discomfort. Remember, the goal of this method is relaxation, not pushing your limits. Practice gently, move slowly, and listen to your body each day to achieve safe and lasting results. Taking care of your blood pressure doesn't have to be complicated or overwhelming. Sometimes simply slowing down for a few minutes each day, breathing properly, and listening to your body can give your heart the chance to rest. There's no need for intense workouts or drastic changes all at once. What truly matters is consistency and mindfulness in every breath. When you build a gentle daily relaxation habit, your body gradually adapts and begins to respond more positively. Stable blood pressure doesn't come from rushing. It comes from small but steady changes over time. If you feel this method is simple and you're ready to start today, leave the number 1 in the comments to let me know you're ready for a change.